We're joined now by the White House Vaccinations Coordinator, Dr. Bechara Choucair. Thank you so much for joining us, Doctor. Let's start with the president's goal of 70% of American adults getting at least one vaccine shot by the 4th of July. How achievable do you think this is?
Well, thank you, Lindsay, for having me here. I think the president has set a new ambitious goal for us to get to 70% of adults with at least one dose by July 4th. We do believe this is an important goal for us. And when we get to that goal, we're going to see steeper declines in the number of new cases, number of new hospitalizations, number of new deaths. And it's going to be hard to get there, but we're going to work really hard in making sure that vaccine access continues to improve. It becomes easier to get access to the vaccine. We have to continue to build confidence in the vaccine, and we have to keep equity at the center of our strategy here to be able to reach that goal.
A recent ABC News Washington Post poll found that nearly a quarter of American adults are not inclined to get vaccinated. Do you think that minds can be changed at this point?
Well, let me just start, Lindsay, by saying we know there are tens of millions of people who are still eager to get the vaccine, and we want to make sure that we're making it as easy and as convenient for them to get vaccinated. Now, we also know there are people who still have questions, and these are legitimate questions, and we need to make sure that we're giving them the opportunity to have their questions answered. That's why it becomes really important for us to further engage our doctors, our nurses. People trust doctors when it comes to vaccine information, and we want to make sure that doctors are available to answer those questions and to be able to provide vaccinations in their offices, particularly for people who still have questions about the vaccine.
And let's turn to the reallocation of vaccine doses. Do you have any concerns about this shift?
Not at all. I think the allocation will continue to be to state, tribes, and territories based on the adult state population. We know that in some places there is still more demand than supply. In other places, it's almost getting to the other side. So we'd want to make sure we're giving the opportunity to states who don't think they need all their doses to put them into a pool that other states may be able to tap into. So I'm not worried about that. I think this is a step in the right directions, and we've had many states have asked us to put this new system in place.
And lastly, how likely do you think that we are to see children vaccinated by this fall?
Well, you know, obviously, as you all know, the FDA is now evaluating a request for an emergency use authorization by Pfizer for 12 to 15 years old. We all know the FDA process is very rigorous. The FDA is very science-driven. It's an independent organization. So when and if there is an authorization used for the Pfizer for vaccinating adolescents, as a country, we'll be ready to vaccinate folks across the country, and we are looking forward to that should there is a decision by the FDA. And obviously, Lindsay, on this front, it's really important that we engage pediatricians and family doctors. That's where adolescents get their care. It's an important part of the strategy. And we also know that pharmacies will continue to be an important part of the strategy. So making sure that the Pfizer vaccine will be available across the country will be an important step there, as well as building vaccine confidence for this population is going to be really important. So a targeted media campaign is going to be part of that effort as well.
And if I can just follow up on that, you know, what do you say to parents who say, well, you know, I was willing to get it as an adult because I'm finished growing. I kind of can anticipate what the worst of it could be. But for children, I still think that there's, let's say, too little testing that's been done so that it hasn't been long term enough. What would you say to kind of allay those fears?
Well, let me just start by reinforcing that the FDA process is pretty rigorous. It is science-driven. The organization, FDA, is independent. It has a very thorough process in place, so I have full confidence in the review process there. The other thing to keep in mind, Lindsay, is this pandemic is unpredictable, and we have to do everything we can to protect as many people in this country as possible. And should there is an FDA authorization for vaccinating adolescents, we absolutely should be doing that.
Dr. Bechara Choucair, thank you so much for your time and your insight.
Thanks so much, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.